All right, I'm gonna try and scoot in here. Nope, you were
Nope.
fine just the way you are. All right, so Dr. Lesho, you were here to talk to us about the coronavirus. I am, real quickly, not ignoring you, I'm trying to pull up the feed on my phone here so that I can see the questions that are being asked. But while we get started, if you just want to introduce yourself to the folks, tell them, your specialty.
Sure.
And
Well, thank you for having me. I'll try to answer and provide some helpful answers, hopefully. I'm Emil Lesho. I'm a healthcare epidemiologist for Rochester Regional Health and an infectious disease doctor.
all right. Okay, I think I'm going to be able to see the comments now. Well, the coronavirus obviously is on top of everyone's mind right now. I think a lot of people are nervous about this virus. What would be your advice to families and just people out there that are a little bit panicked right now?
Well, I think that's a great question, and they're understandably concerned because of all the information that's coming out and sometimes the misperceptions, etc. And so I think the important message is back to the basics and do what you can to keep yourself healthy otherwise. Number one, if you haven't gotten the flu shot, we're still seeing a lot of flu cases in Monroe County. And actually, several people in Monroe County have died from the flu. But fortunately, we haven't had any COVID-19 cases. So do the things you need to do to keep yourself healthy. Get the flu shot, get any other vaccines that are recommended by your primary care provider. I mean, it sounds boring, but get plenty of rest, because when you become run down, then you are more susceptible to getting an infection, excuse me. Hand hygiene, frequent hand washing. So what this COVID-19 is primarily spread by larger droplets. So when you cough and you sneeze close to somebody, or when they cough into their hands and then open up a doorknob, and then you immediately follow that and open up the doorknob and then touch your face or scratch your eye, that's primarily how you get this disease. So frequent hand washing. And it doesn't have to be hand sanitizer. I know there's current shortages of Purell and stuff like that. Good old soap and water, and for a couple, 10 seconds, or they sing happy birthday to yourself, but hand washing. Avoid becoming run down. I would not necessarily spend a lot of time in very crowded, I don't think this is the time until it settles down or we know more to go to heavily crowded venues. So you would consider maybe avoiding close contact in crowded venues. The other, because how we define close contact is closer than 6 feet. So if you're in a situation where somebody might have COVID-19, your risk of potentially getting it is higher, of course, if you run down, and if you're closer than 6 feet for more than 10 or 15 minutes with them.
Okay, we're starting to get some questions here. Jennifer is asking, is this virus affecting pregnant women?
I don't know, to be honest, and there haven't been a lot of reports about fetal outcomes or baby outcomes. But that is a good question, because typically this is a respiratory virus, as is the flu, and oftentimes pregnant women can have worse outcomes if they get the flu while they're pregnant. So there's reason to expect that it will cause infections in pregnant women, but it's just too new for us to know the exact outcomes right now.
Larry wants to know how long the virus can live on an object. So let's say you ordered something, it's being shipped from China straight to your house. Should you be concerned?
No. In that situation, no. I mean, that box and whatever is going to go through a lot of different steps. And so the short answer is, and we are concerned about this, where we particularly worry about this is on hospital surfaces or surfaces in doctor's office, because we have cleaning protocols with that. And the scientific report, there was a recent scientific report that actually has the similar viruses, and they put it on tabletops and countertops, and you know, they try to reculture it and recultured it. And so based on that fairly you know, valid and thorough science report, it was 9 days. But that is kind of in an ideal situation where maybe it's moist and maybe there's no, you know, wind or freezing and stuff like that. But the short answer is it depends on the conditions, and I wouldn't be worrying about packages coming to my house or money, although, you know, money...
I was going to ask you about that, because I
Right.
saw a report today that, you know, there were claims that if I'm sick and I, you know, go to a store and pay you, there's a good chance you could get it.
Well, there's a theoretical chance where if you sneezed and coughed and, you know, covered your mouth with your hand, and that's why one of the things we advise people is to cough in your elbow, or sneeze in your elbow. But if you recently coughed in your hand and then, you know, seconds later grabbed some money out and, you know, rubbed it in your hands and then gave it to somebody and they handled it, sure, you know, there could be a possibility where the virus was transmitted that way. But that person would have to have taken that money and then, you know, immediately, you know, touch their mouth or their eyes with it or something like that. So if you're handling, you know, money, you know, wash your hands as much as you can.
Yeah.
And some of the...
Which you should do anyhow.
Right, right.
We're getting so many questions here on Facebook,
Oh, okay,
which is
I'll keep
wonderful.
them, I'll try to shorten the
No,
answer.
this is wonderful. Anthony had asked, and where did it go? Is testing being done locally yet?
Great question. No. The short answer is no. If you want to get tested, well, I should say it this way, because if you just can't come and show up to your clinic or your local emergency room and saying, I want to get tested. That is not possible. For a testing to happen right now, and this is changing frequently, but for right now, for the immediate future, your provider would have to call the local health department, and they would get a testing number, because you would have to have risen to a certain level of suspicion to be considered a person under investigation, a PUI. And you would have to meet certain criteria to qualify to get the test. Your provider would then give that test and call the health department. The health department would say, okay, collect the samples and send the test. The test is sent to Wadsworth, Albany in New York, and about a day or two, depending on how backed up they are, that's when the results come back. So you might say, who is then going to be eligible to get this test? Because testing availability is so limited, we are kind of triaging it to the highest risk patients. And so those would include somebody who's in the hospital or going to be admitted to the hospital that has a severe respiratory illness and a fever. Or if there's a cluster around in the community and a person who is otherwise healthy has had close contact with a laboratory confirmed case.
Okay. Barb has a good question here. It's my understanding the virus affects the lungs. If someone gets the virus, what is the best thing, if any, they can do to protect their lungs? Meaning steam and expectorant.
No, I mean until you're, you know, try to. She's right. The virus does primarily affect the lungs, and respiratory viruses usually behave in sort of one of two ways. If you want to kind of look at it, does it cause an upper respiratory syndrome? And that's what our head colds are, which are a type of coronavirus. Lower respiratory symptoms are like pneumonia, and that leads us to what these symptoms are. So that's where you get the symptom of shortness of breath and cough. But other than trying to keep the virus from getting in your lungs, once it's in there, it's up to your body to try to fight it off. And so one of the things, a big thing that impairs your body's lungs to be able to get rid of contaminants and infections is smoking. So try not to smoke. But other than that, you should just try to, by washing your hands, by avoiding close contact with sick people, by staying home from work or school. If you yourselves are sick, that's how you can protect yourself and others.
Okay, we had another question here that if you do have it, how long does it last?
The symptoms are, people with, it lasts about 2 weeks would be a short answer. But it's hard to know because most of the data, most of the reports are coming from China. So we'll see, as we see more and more cases and get more and more reports, detailed reports from within the United States, we'll know more about how it behaves. But the incubation period, in other words, the time from when you get infected with the virus to when you become symptomatic is anywhere from 2 days to 14 days. That's where that 14-day period comes in. and people who are getting, some people have the virus and are completely asymptomatic. Other people that are elderly mostly, and people that have a lot of other illnesses. So if they already have bad lung disease, bad emphysema, or they have bad diabetes, or they're elderly, like over 70, for example, they are more at risk for severe disease.
Okay. Someone here is asking if asthma is considered a pre-existing respiratory condition.
Asthma itself is probably elevates your risk slightly, but and it would have to be combined with other. If you're a young, healthy person with mild reactive airway disease, probably not. But if you have like an asthmatic component of emphysema, and you've been smoking all your life, or you've had bouts of repeated pneumonias in the past that may have been so severe that they caused some damage to your lungs, then yeah, that would elevate your risk. But if you're a young person, you're otherwise healthy, and you have asthma that maybe you just take your inhaler before you exercise, or a couple puffs from your inhaler once or twice a week, I don't think that you're at that much of an increased risk.
Maureen wants to know if you have coronavirus, how long are you contagious to other people?
As long as you're symptomatic. Well, that is another good question. And again, this virus is so new that we don't know. But what we think is that as long as you're febrile, you are probably shedding virus. So as long as you're febrile, you have a fever and you have symptoms. We're pretty sure about that. That's definite. But the question is, how long are you infectious to people if you don't have any symptoms, or if you have mild symptoms? We'll know as more and more testing becomes available, and we start testing a larger number of patients. We'll be able to answer that question a little better.
Mia is asking, are we seeing the young pediatric population being affected? That's a good question.
Yes, we are not. So I don't want to. So for some reason, this particular virus at this particular point in its evolution seems to be sparing younger people, and notably, there have been a remarkable, small amount of pediatric cases.
Mm-hmm. We have a question here from Teresa that says, I know they say you don't need a mask, but can I pass on the illness before my symptoms start?
Yes, you can. But again, what can you do about that if you don't even know you have it?
Right.
It's just back to the basics. If you're, you might be sneezing because of an irritation, not because of anything else. But who knows? If you happen to be, one of those persons who has like a silent infection, don't cough on people, don't sneeze on people, sneeze into your elbow. Wash your hands frequently. Try to keep yourself healthy.
Okay. Dr. Lesho, he's an infectious disease specialist with Rochester Regional Health. If you guys have questions, go ahead and ask them. I'm trying to ask as many of your questions as possible.
If there's questions coming in, I'm just.
Oh yeah, there's
okay.
Lots of them.
Right,
I'm trying to keep up. Are children carriers, meaning they don't have symptoms, but they could have the virus, and can they pass the virus?
I think there's probably, yes, I think there's reason to think that that's the case, sure.
David,
even though they don't get sick from it, or a lot of them don't get sick from it, or they don't get severely sick from it, there's reason to believe that they shed virus.
Mm-hmm. David just asked a really good question that I thought of earlier today. Can pets get the coronavirus?
I don't know. I would pose that question to the veterinarian.
To a vet.
Yes.
Okay. Maureen, here's another one.
However, though, pets do get respiratory viruses in general, like Bordetella, where there's a vaccine for dogs for that, or kennel cough. So kennel cough is a respiratory virus. So I would think, just based on extrapolation, yes, they might be able to, but the honest answer is I don't know.
Okay. Maureen would like to know, would keeping disinfectant wipes in your car be advisable?
Definitely. I mean, I try to keep one or two too, because you never know, who's driving, especially if there are other drivers of your car. Especially if you're sharing rides, or you have a large family and your school-age children are driving the car, and then your spouse is driving the car. So sure, it pays every now and then to take one of those and wipe off the steering wheel and the gear shifter. Sure, especially in the height of flu season. That would also help you keep from getting the flu, and it would also help you probably keep from getting some of these pesky common colds.
Cassandra is asking, will a mask protect me when I am flying from getting it?
So a mask is primarily to protect other people, and that's why you see doctors and a lot of doctors wearing them. And that's one of the reasons why New York State has a law that say if hospital workers don't get the flu shot, they have to wear a mask for the whole flu
Right.
season. It's not because they're worried about and we are, but it's more to protect the patients. So wearing a mask, where that really helps is if you're symptomatic and you're sneezing and you're coughing, the mask is going to catch some of that. So that's you would hope that if somebody's on the plane with an illness that they're symptomatic, they would be wearing a mask to help protect you. But no, it probably wouldn't provide much protection on a plane.
I know just from being out at Wegmans.
And furthermore, an important point to make is sometimes wearing a mask will give people a false sense of security. You touch your face roughly about, from some studies I've seen, about 20 or 25 times an hour. And if you ever wear one of these masks, when we have to wear them, most of the time they're pretty uncomfortable. And so I think you put a mask on, you're going to increase that number to maybe 30 or 50 times an hour because you're going to get itchy and scratch it or whatever.
Yeah.
The important thing to do, though, is make sure that mask is handled properly. So if you are wearing a mask because you're symptomatic or because it's recommended, and throw away it properly, it can become a vector for spreading it itself.
Nicole has a really good question here. Besides testing, how do you know the difference between the flu and coronavirus?
That's a great question.
Yeah, to go off of her question,
that's why we're so challenged.
At what point do we call our physician?
Okay. You should, if you think you're getting sick and you want advice, call your physician, or your healthcare provider anytime. But the guidance that we're preparing, and based on what we receive from the health department and the Centers for Disease Control, we are recommending providers to do as much care as they can, either through telemedicine or on the phone, because you don't want somebody that's contagious coming into the waiting room. Now, of course, if what we're saying, that's not to say if people need care, they shouldn't seek care. That's not what we're saying. We're saying if a lot of people get the flu every year and don't see their doctor. They tough it out at home. And in similar case, that's what we're sometimes recommending. If you have no other illnesses and you're relatively mild, you have a fever, but you're not unstable, then try to tough it out at home, but call your doctor and see. When you should seek care, if you don't know, that's a tough question, and it's like on a case-by-case basis. So if you have a high fever, if you're having difficulty breathing, a lot of shortness of breath, then you should definitely call. If you have to, obviously you can't call all the time. Sometimes you're just going to be so sick, you're going to, get to the emergency room or the urgent care. If they forget to ask you, please tell them right up front, I'm having fever, I feel feverish, and I'm having shortness of breath. At that point, they'll put a mask on you and, take care of you.
We've been hearing stories about people, running out, stocking up on masks, Clorox wipes, food. What type of preparation would be sufficient for someone to have at home? I mean, I think you don't want to go overboard.
No, you don't. And am I telling my family and friends to go out and, stockpile things? No.
No.
What I'm saying is, though, is that, we expect cases to increase in the community. We expect to see them. We know that there's transmission occurring. We just don't yet have the ability to test as many people as we would like to. And if we have to quarantine, some people will have to be quarantined, or some employers are requiring their employees to stay home if they get sick. So you want to have something on hand where, that would minimize your need to go to the grocery store frequently. So I would think, when you're going for your normal shopping trip, maybe pick up an extra roll of toilet paper, an extra, TV dinner or something to keep if you're, confined for a while, a little more comfortable. So you're not eating baked beans in cans for 2 weeks.
So things that you should have in your house anyhow, in case you come down with the flu or something else.
Exactly.
Okay. Maureen is thanking you for doing this. I know there's a lot of people that really appreciate you taking the time to answer all of our questions and help us out here. Let's see. Gosh, there are so many good questions here.
take your time. I mean,
Oh my goodness, I know I'm trying to keep up. You guys have so many awesome questions. I really cannot thank you enough. Someone wants to know the mortality rate.
So if you look at the largest report of the study right now that currently is from China, it's about 85,000 patients. All comers, the mortality rate is between 1 and 2%, about 2%. To put that in perspective, the mortality rate of the flu is about 0.6% or 0.7%. So it's a little bit more. That's not to scare people. That's not a fear factor. That's just to give you perspective. So, and that's one of the reasons, along with this thing being new, that's one of the reasons that we're concerned about it, because it has a little higher mortality rate than the flu. But now that's overall, that's all comers. There are some populations that have a low mortality where they did mathematical modeling and the mortality is less than 1% in those populations. Mm-hmm. The problem is to get a really, what is the mortality going to be in cities in the United States? You need a denominator. You need a number, and the denominator is how many total cases do we have out there?
Right.
And then how many people died over how many total cases are out there? That gives you the true mortality rate. We don't have a denominator. Right. So we just have how many people have been tested and then how many people have died.
And much like the flu, you probably won't ever know the total number.
Right.
Because some people
will never get tested.
Right.
Exactly.
Gosh, I had one other question here that was really good and I lost it on this feed. I had seen a report yesterday that the virus has mutated and now there's 2 strains. Is there any truth to that?
I don't know. I haven't heard it. And if the updates come in so fast, it's hard to keep up. I haven't heard that there's 2 strains. And you have to be careful what you mean by a strain. A strain can be a totally different species. It could be but it could also relate to relatedness. In infection control, when we do the genetic fingerprinting, for example, we speak of strains. And that strain is only important for trying to determine if I got my virus from you. Mm-hmm. Then I would do the fingerprint. So overall, it's not a new strain, but my virus is either different than yours by a couple of letters, or it's the same from yours as a couple of letters. That said, the concern about respiratory viruses and the flu virus is that they do tend to mutate. And that's the reason why we need a flu shot every year, because there's a little creep of mutations, and then last year's flu shot doesn't work. So we hope it doesn't mutate to the extent where it becomes more lethal or it becomes more contagious. Usually, the good news is it's a trade-off. So the virus, if the virus goes one way, it sacrifices in another way.
Maureen has another really good question here. Once you recover, do you have immunity or can you get it again?
I don't know, and because it's so new. There are, if you again extrapolate from other vaccines, so other SARS virus that are highly, in the same family of this are SARS and MERS, CoV, and there have been vaccines sort of developed and implemented for some of those with some degree of success. So there is reason to expect that you might be immune to this. But then on the other hand, the common cold is also a coronavirus, and you get colds, 3 or 4 times a year. So it remains to be seen.
And I know a lot of people are wondering about a vaccine.
So the good news about vaccine, there's good news. The good news here is that the virus, laboratories can grow the virus and they can clone the virus, and that's one of the first steps that you need to make a vaccine. And there are already platform vaccines, vaccine candidates or vaccine constructs, and some of these come from the MERS-CoV and the other SARS vaccine. So there are potential candidates that are waiting, but even under the best of circumstances, it's going to take a year or longer, as Anthony Fauci from the NIAID has said, and that's because you first have to make the vaccine. So we're ahead of the game there for the reasons I mentioned. You then have to put the vaccine in a small number of patients and see if it does anything. In other words, if it's worthy to be put into a larger group of patients. And each of these things takes time, and you have to recruit patients, which would take time. But, I would want to take this opportunity to point out that we have a vaccine. We have a lot of very good, effective vaccines, but there's a vibrant anti-vaccine movement out there. Yeah. We have a flu vaccine. A lot of people don't get the flu. Measles vaccine is one of the most effective vaccines, and you saw what happened in New York and California when people don't get that vaccine. So I think putting all your eggs in a hope for a vaccine is it's important, but it's not the best approach.
Anthony has a really good question here. He says, so without an exponential increase in testing soon, how can we be assured that we won't risk infecting older relatives if we are asymptomatic?
That's a good question. You can't. And so that's why we're recommending that if all you can do is what you know about, right? So you don't know if you're happy and healthy and you have no symptoms, I would proceed as usual. But if you're sick, if you have the symptoms, and you have elderly, frail, don't visit them until you're symptom-free and until you don't have any fever. If you must take care of them, if you're in a situation where you're sick and you have to take care of them, I would try to wear gloves. That would be a critical time for you to have a mask when you're close contact with taking care of an elderly family member.
All right. We are getting so many people on this feed thanking you for your expertise.
Oh, thanks.
And I have a feeling that we could stay here all night and we would have so many wonderful questions. Real quickly, just before we say goodbye, what's your final piece of advice to folks that are watching this?
I would stay calm. I would not panic. We say we have a quip, an epidemiologist, every outbreak is an outbreak itself, an outbreak of fear, and an outbreak of meetings. We don't want to have an outbreak of fear, so I would stay calm. I would listen to respected authorities, the people. There's a great resource at the local and state health department have a website. There's frequently asked questions on there. Feel free to visit those websites. Visit the websites that are always updated at the CDC. The CDC has places for healthcare providers and for patients. Definitely, if you're going to travel to a high-risk country, look at that before you go. And those countries right now include Japan, South Korea, Iran, Italy. I would not travel to these, and actually there's advisements against traveling to some of these countries.
All right. Doctor, thank you so much for your time. We really do appreciate it. And thank all of you for your wonderful questions. We appreciate it, and I'm sure we will be talking again soon.
Thank you.
Thanks so much.